Don't seem to have any papers or my notebook. I think they're in my room. If we carry on by the time someone's been upstairs. Can we get a message? Okay, thanks.
Thank you, my lady. I was simply going to introduce to you this morning that, as I said yesterday, we have a number of witnesses this morning who are giving evidence from a number of impact organisations. The first witness this morning is Mrs. Jadeen Morrison.
Thank you.
I do solemnly,
sincerely and truly,
declare and affirm
that the evidence I shall give
shall be the truth,
the whole truth,
and nothing but the truth.
Good morning, Mrs. Morrison. If you could try to speak as best you can into the microphone so we can hear you nice and clearly, that would be much appreciated. Thank you. You are Mrs. Jadeen Morrison.
Correct.
And you have already given evidence, I think, to the inquiry in its Module 1.
Correct.
And you give evidence this morning on behalf of an organisation to which you're affiliated called Scottish Covid Bereaved. Is that correct?
Correct.
And you provided a witness statement to the inquiry dated the 20th of March 2023 under reference INQ 000144794. That was your witness statement in the first module to which you spoke to an extent already. And Scottish Covid Bereaved has also provided a response to the inquiry's impact questionnaire, which can be found at reference INQ 000099718. Is that a document with which you are familiar?
Yes.
I think you must, at the very least, have had a significant part in its creation. If not, you are actually its creator.
Well, a wee bit.
Yes, there are some references, I think, to your personal situation.
Yes.
If I could just ask you some questions about that, Mrs. Morrison. I understand that in October 2020, your wife, Jackie Morrison-Hart, died from COVID.
Correct, yes.
And she caught COVID in hospital, as I understand it.
Correct.
And as I understand it from the testimony that you've provided to the inquiry, she was an inpatient in hospital, having developed jaundice, and she was undergoing some tests.
Correct.
And she had been in hospital for 2 weeks when she caught COVID, catching it on the 15th day of her stay in hospital.
Correct.
And I understand that the tests for her underlying health condition had taken much longer than would have been the case before the pandemic.
That's correct, yes.
Well, why was that?
For things like scans, every time someone went in the scan, it had to be thoroughly disinfected afterwards, and then they had to wait at least 20 minutes before they could let another patient come in and use the scanners. So it was tending to be 3 days between tests rather than just following one after the other.
I see. So this prolonged her stay in hospital?
Very much so.
And as I understand it, she'd been in hospital for 14 days and she caught COVID within the hospital. And that's a term which is often applied to that, which I see in some of your testimony, is a nosocomial infection.
Correct, yes.
Meaning one that is caught within a hospital environment.
Mm-hmm.
And I understand that her condition deteriorated quickly and sadly she died only 5 days after the onset of her infection.
Yes, it was very quick because in the 5 days, the COVID, which many people still think of it as a respiratory condition, but it has a very big vascular element and it destroys the lining of the blood vessels. And in those 5 days, it had clogged up her lungs, her kidneys had failed, her pancreas had failed, and her liver had failed, all because of the COVID. And they tried to do dialysis and they couldn't do it because her blood was so sticky because of the COVID, it actually broke the machine.
Right. Well, may I pass on the inquiry's condolences for your loss?
Thank you.
Were you given an opportunity to say goodbye to her?
I was very lucky because I didn't think I was going to be given the opportunity because Jackie had been told because of the liver failure in particular, she was not a candidate for ITU because it'd only be prolonging the inevitable. So she was told that on think it was Saturday afternoon the 24th, and we knew then it was just a matter of time. She was on maximum CPAP, and they couldn't get her oxygen levels above 60% because of the COVID. And I thought, I had a phone call with her, and I thought that was a final phone call. But the consultant very kindly managed to find a side room, because in that particular hospital, they made a hospital within the hospital. So they had a COVID ward, a high dependency unit, and intensive care. So they managed to find a side room in the COVID ward. So I didn't, because I wouldn't have been able to go into the high dependency unit. And it's an hour's drive from home to the hospital. So I managed to get there just in time. I had about 15, 20 minutes with her. Yeah.
And I think after your experiences, you met up with, or you came into contact with some other people via Facebook, I think, who had, if not similar, but broadly similar experiences of the COVID pandemic in Scotland. Is that right?
Yes, what happened, it was the Facebook group at that stage covered the whole of the UK, which was the COVID Bereaved Families for Justice. And I joined that, and within that, Alan Whiteman was identifying all the Scots. So we became initially the Scottish branch of that unit, but subsequently we became an autonomous, completely separate group, Scottish COVID Bereaved.
And I think that was in about March 2021, was that right?
March 2021 was when we met Nicola Sturgeon, right, and spoke to her. And it was over quite, well, once we knew the public inquiry was happening in Scotland, we were aware we would need a Scottish legal team to deal with that. And they were introduced to us by the English lawyers for the UK group. They actually approached Amar & Co and got them on board. And then the more we thought about it and the more our own personal knowledge grew, it seemed to us eminently sensible to have the same lawyers for both inquiries, and then nothing falls through the gaps and we don't miss. And it also avoids a lot of duplication as well. So we decided that we'd do that. And it was a process over several months, really. And by the latter half of 2022, we had a completely separate group. And prior to that, we still had been part of the UK group.
We certainly hope that nothing will fall through the gaps, Mrs. Morrison. Could I just ask you a few questions then about the group? Obviously, it's evolved over time, as you've just explained, but I understand that the group represents people from many different backgrounds who have had varied experiences of the COVID pandemic.
Yes.
And in particular, given its name, they represent a number of people who have had different experiences of bereavement.
Yes.
But there are a number of different people who are not necessarily directly bereaved who are involved with the group too, is that right? No. Some who perhaps work as frontline workers? No,
everybody in the group has been bereaved, but within that group of bereaved people, we have a variety of people, such as frontline workers, healthcare professionals, teachers, and so on. So we have a very wide variety of people with a lot of experiences in addition to their bereavement experiences.
I see. And I understand the group may also represent some people with long COVID?
We have some people in the group with long COVID, but we do not represent a long COVID group, if you follow my logic on that.
I see. But the group has a wide variety of people and experiences upon whom it can draw in
Yes.
order to form views and raise concerns about the COVID-19 pandemic in Scotland.
Yes.
And it has people from different parts of Scotland.
Yes, yes. All
And
over
it
Scotland.
has people whose relatives have died of different ages.
Yes.
And it has people in it who have suffered bereavement at different stages of the pandemic as it ran over our scope of more than 2 years.
Yes.
I would like to ask you a few questions about a number of the issues that you have very helpfully raised with us, and I understand you may have raised with government in Scotland, arising out of the experiences of the group in order to understand them a little bit better. As you will understand, this module concerns government decision-making, and you have raised a number of significant matters, important matters for us, and I'd like to understand the group's perspective on those a little more, if I might. I understand, as you've already said, that you've been able to have a number of meetings with Scottish Government, one of which took place with the First Minister, Nicola Sturgeon, in March 2021.
2022.
2022.
Sorry, no, you're right. It's the 22nd of March, 21.
2021, right.
Yeah, sorry.
So obviously at that time in 2021, as our summary of the chronology yesterday showed, the pandemic was very much still going.
Yes.
We were roughly at the stage, I think, to contextualise, of coming out of the second lockdown.
Yes.
Roughly. Mm-hmm. And I understand that you, at that meeting with the First Minister, raised a number of the group's concerns, and that the principal purpose, if you like, of raising these concerns was to address those individually, but also to try to make progress about having an inquiry into the Covid-19 pandemic in Scotland.
Yes, the main purpose of our meeting with the First Minister was to share our experiences with her and to get her agreement to a Scottish public inquiry. And whilst naturally with sharing our own experiences, and we told her about some other issues as well. We were doing, so she did hear a wide variety of issues.
Well, I'd like to address some of those issues with you. Helpfully, you've produced a number of these issues in a list in the impact questionnaire response. So we could have that up, please. It's INQ 0000099718. And I'm looking at page 5, which is Appendix 1. Thank you very much. And you've helpfully, in this section of this document, raised for us a number of matters that you raised verbally with the First Minister at the meeting, and I'd like to address some of these with you. Issue 1, you raise a question relating to care homes. Is it the case that there are a number of people who are within your organisation who have experienced bereavement of relatives who are in care homes in Scotland?
Yes, 9% of our members have experienced bereavement in care homes, yes.
So this is a significant cohort.
Yes.
So was that 9 or 90?
9.
9.
And you raise at issue 1, as we can see there, it says, how at a time when there was said to be a protective ring around care homes and WHO was repeatedly stating test, 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 does the government justify sending untested hospital patients into care homes full of vulnerable people? Is there a particular time period that this particular concern relates to in our pandemic chronology?
This was predominantly in March and April 2020 at the start of the pandemic, where we had all these issues with care homes. As time has gone by and I've learnt more, I do wonder how much of it is linked with the guidance that initially came out. It was Sage 6 on the 11th of February said we had to proceed with the assumptions of a flu pandemic. And with a flu pandemic, it's decided that the elderly were the least at risk because of years of vaccine and years of exposure. And in 25th of February, Public Health England, who were the lead public health people for the joint approach, they issued guidance saying it was very unlikely that care homes would get any infection in them. And they said that a couple of times, and I think that existed until the 13th of March. So we had that, and of course, as we now know, there was a lack of testing capacity. But that also raises its own issues, because when we get to 25th of March, the British Geriatric Society issued guidance saying that geriatric patients do not exhibit the same symptoms. And I believe it's only 20 to 30% that will actually present with a fever. Their other symptoms are completely different. So there's an awful lot of stuff, and I'm glad you're having a separate module on it, my lady, to do that. So.
And you were raising these matters with the Scottish Government in 2021.
Yes.
And you were looking, I suppose, for answers from them as to how these things had been allowed to happen.
Yes.
Some of which you've managed to find some answers to it, it
Yes.
appears. What role did you understand that Scottish Government had played in the period, the early period that you've referred to as regards care home?
Yes.
Fiction?
My understanding is that I don't know who made the actual UK decision that so-called bed blockers should be discharged into care homes. I don't know who was the author of that decision, but the Scottish Government followed that approach, and it started on the latter half of March 2021, as I understand it. I also believe that, apart from them not having enough tests at that stage, that it had come from Sage and Chris Whitty as the UK CMO, that they thought the tests would not recognise asymptomatic transmission or pre-symptomatic cases. So they only thought it would recognise those who actually had the COVID symptoms. So.
I think you referred there, inadvertently, I think, to March 2021. I think we were talking about March 2020.
Sorry, yes.
The Scottish Government got it. It is extremely difficult to remember which year we're talking about. I think I fell foul of that myself yesterday in the opening.
Thank you for clarifying that.
Thank you. Did your members who had suffered bereavement around that time, you mentioned a moment ago pressures on hospitals as being a factor in this story. Did the members of SCB have experience of pressure being applied to them or the individuals who subsequently died to be transferred from hospitals to care homes around the period we were discussing?
Yes, yes. We actually had instances of some members actually pleading with the hospital not to discharge their relative. There seemed to be a lot of things that hadn't been considered. For example, the difference between a care home, which is more a residential place where people will help you with your daily living, and nursing homes, which of course will have a nurse on staff. So for those who were in care homes as well, they very often didn't have the experience or the facilities to cope properly with patients who had been discharged if they had to isolate or if subsequently it turned out they did have COVID.
So let me get this right. There are stories of pressure being applied to move people out of hospitals to care homes.
Yes.
But there were issues about infection control measures and other aspects of the way that care homes function that meant that that might well not have been suitable at the time.
Yes.
Thank you very much. I would just like to ask you a few questions also about issue 2, which is still on the screen. It says there that we all saw the scenes on the news from Italy and Spain depicting the COVID devastation in care homes. Why was the lead time we had in Scotland not capitalised on to provide infection control and PPE training and support in care homes? I think would it be fair to say that the theme of Scotland having a degree of advance warning about things is something that comes up on a number of occasions in the statement that you've given?
Yes.
And this is one example of it, where you're drawing attention in the context of care homes, but one might perhaps say more widely, to scenes of devastation, problems arising in other countries.
Yes.
And there being an issue on the mind of Scottish COVID bereaved as to whether that warning had been properly heeded.
Correct.
And does that apply specifically to care homes, or is there a more general concern about that?
In the early days of the pandemic, it was generally, and because it related as well to issues such as PPE. You know, I think in February, the UK government sent PPE to China, for example. You know, so there was not this, well, there was a sort of, it won't happen to us, you know, we're on a little island, we'll be all right. That was the impression we got. I mean, whether that was their actual thought or not, I don't actually know.
Because in this regard, you also raise, if we could just go over the page, I wanted to jump to issue 8, which seemed to me to be connected to this. At issue 8, you say, did trying to go for a uniform UK-wide approach at the beginning of the pandemic delay an earlier response if Scotland had just gone for it alone?
Yes.
So again, you're focusing there on this very early period. And one of the questions that you wanted an answer to was whether Scotland could and should have taken an autonomous approach.
Yes.
I mean, the issues that we've touched upon, health and social care, are devolved matters to the Scottish Government, aren't they?
They are, yes.
So what you wondered was whether going along with a uniform UK approach was something that the Scottish Government might have done otherwise.
Yes. I mean, for example, we asked about border controls. Why didn't we just shut the borders and keep everybody out? And it was explained to us that, yes, we could shut the border, but the border force for the monitoring of it is controlled by Westminster, not by Scotland. So they couldn't have the monitoring done at the border. And also the financial aspects of everything. Scotland does not have its own authority to raise funds such as the UK government has. So they were very limited what they could do within the financial constraints as well.
So it sounds like from your obviously extensive analysis of matters, Mrs Morrison, that in the early stages, issues arose from the devolution settlement, which, given the all-encompassing nature of COVID, created difficulties about whether the Scottish Government should go one way or the other. But you wanted to know, I think, Issue 8 suggests, why did they not go their own way?
Yes.
And did you, other than what you've said, did he give you what you consider to be a satisfactory answer to this, either at your meeting with the First Minister or subsequently? Does this remain an issue for you?
It does remain an issue, and hopefully we can identify some of that in this module.
I very much hope so. There's another issue which I wanted to ask you about, in particular because it relates to your own situation. Again, if we could go over the page, please, to issue 13. You say there is real concern around hospital-acquired COVID-19 and hospital transmission, and yet my wife, which was the reference earlier, I think why you must have written this, was allowed to walk through the corridors of Hairmyres Hospital, having tested positive for COVID-19 at her leisure without as much as a face mask on.
Sorry, to stop you there, that's not...
Oh, that's not your story, I'm sorry.
No, it's, these bits are from the 5 of us who were there.
I see, I understand.
Just a little bit of stories. This was another member's wife.
I understand.
But I can...
I'll just finish the quote and ask you to explain. Yeah. At this time, the hospitals were not particularly busy. Why were you sending COVID-positive patients home? So I had understood this was your story, but it bears a number of familiar hallmarks from your story. Could you explain, therefore, what this story emanates from, and to the extent that you're able within the group explain the significance of nosocomial infection and the efforts made to prevent it within the group's concerns?
Yeah, just as it says later down in the statement, as a group, 25% of our members have lost someone to nosocomial infection. And that has stayed a fairly consistent figure as we've grown as a group. And this particular issue had a number of points into it. This gentleman's wife was shielding, and then the shielding stopped, and she was told to go back to work. She got COVID, went into the hospital, but they thought she was well enough to send home. But they said to her to just go, and she was able to walk through the whole hospital without wearing a mask, whilst having tested positive for COVID. On that one, this is what the situation was, and she subsequently passed away with COVID.
And is the issue of the extent to which infection was controlled within hospitals a wider issue for the members, the 25% of the SCB? Yes,
there's a number of elements to it. I mean, I've read quite a few infection control plans. One of my ways of coping with everything was to do a lot of research. And they focus solely on the nursing medical staff and what they have to do. The only reference I've seen in relation to patients or visitors is they're invited to use alcohol hand gel. And I have not seen any procedures for visiting tradesmen or repair people, porters. Porters are covered on that. So there's some gaps. But to us, one of the biggest gaps is when COVID started, certainly in the hospital that Jackie was in, they set up a system. You could only have one named visitor for the duration of that patient's stay. This was before she got COVID. and they had to make an appointment so they didn't have too many people on the ward at once, and wear hospital face masks, gloves and a pinny. Apron, as we say. And which we're doing, but every time I went to visit Jackie, outside of the hospital, you had patients who'd come outside and they were meeting friends and families in the car parks with no masks, no social distancing, and in groups of up to half a dozen. And I saw it with my own eyes. When they finished, they'd walk back into the hospital and they wouldn't even use the hand gel. So it's, it makes a mockery of much of the infection control, because it's like putting down a portcullis to stop a swarm of bees.
And can you, as we did with the care homes, can you give me some idea of the time frame over which these concerns about, I think, the guidance, but also the enforcement of any guidance, caused concerns to the members of the SCB?
It's throughout the duration of the whole pandemic.
Thank you. There's another issue I'd like to touch on, two other issues I'd like to touch on with you, if I possibly could. It's issue 11, so we go back a page, please, Lawrence. Issue 11 relates to shielding, which is something that I think we will touch upon in this module, and a particular issue relating to Scotland, which I wanted to raise with you on behalf of the members. Why did the shielding end at the start of August, when people were being allowed to go on holiday and no doubt bring variants back into the country? The Eat Out to Help Out scheme was started, the schools were returning mid-August, and the universities shortly after. Surely if there was modelling being carried out, it would show this was probably the most dangerous time to stop shielding. Again, could you explain this? There's a lot in that about factual information, some of which I'd summarised yesterday. But I think this relates to a decision in August to stop the shielding scheme. Is that right?
That's correct, yes.
Is it on the 1st of August, I think?
I'm not sure of the exact date. Sorry.
In August.
But it seemed that, I'll come back to the shielding if I may, but it would seem that when you've got your numbers down, that you should gradually release the controls. And what was happening was everything was being released at once, plus additional things like the Eat Out to Help Out scheme was introduced. So people going from social distancing, minimal contact, suddenly they were let out and everybody went a bit wild. And that coincided with stopping shielding. So where you would have been in a position where the person who'd stopped shielding would have gradually readjusted, it meant that if they were told they had to go back to work by the employer, for example, they were just exposed to every possible source of contamination with the virus.
So at that point, these decisions were being made by the Scottish Government. What you wanted to point out was that there seemed to be an incongruity between the fact that there were releases happening on the restrictions, but also the most vulnerable were being exposed to that.
Yes.
And is that a common issue, that particular issue amongst the membership?
Yes, there's quite a few members who are affected like that. I understand, and again, it's one we need to understand what was the UK decision that started off, because of course it happened in the whole of the UK, and how much autonomy did the Scottish Government have?
Mm-hmm. That would be one of the questions that you would like an answer to.
Yes.
Another issue that I wanted to touch on with you briefly is issue 15. So if we go back over the page again, please, Lawrence. Issue 15, which is something that comes up on a number of occasions through the SCB materials, is that you say their symptoms are poorly understood and are not well publicised outside of the usual three: fever, persistent cough and loss of taste and or smell. More symptoms need to be listed and a public education campaign launched. And you wanted to ask Nicola Sturgeon and others, would they commit to that? To what extent is this a concern? What are the sorts of symptoms, for example, that you would like to see added, either at the time you're having this meeting in March 2021 or indeed now?
To go back to this just before, I know that Mr. Youssef wrote to UKHSA, because they are the owners of the symptoms, so to speak, to ask if it could be extended, and they declined to do that. The issues for us, we've got an awful lot of people who've been bereaved by COVID, and those symptoms were not the primary symptoms, particularly in the early days when it only went with fever and persistent cough. before the added loss of taste or smell. And as I mentioned earlier, particularly with older patients who didn't present with those symptoms as well. So it was a big concern. I suspect that a lot of it, again, was down to lack of testing capacity, but we should have had, even if we couldn't test for it, we should have had more education given to the public saying these are the main symptoms, but you might also experience gastric symptoms, you might experience lethargy, confusion and things like that.
So would the result of such an approach have been more precautionary in the way that it would have perhaps prompted more people to take a test or more people to regulate their conduct such to minimise the risk that they might spread the virus if they had it?
Yes, yes.
So rather than being restrictive, a wider definition may have had that effect.
Yeah, and it also had the effect that we do have a few people who lost someone where they thought they had COVID, but because they didn't have those 3 symptoms, well, this particularly in the beginning when it was just the 2, they were told you don't have COVID. They were denied a test because they didn't meet the criteria. And it was very difficult for them to get help because they were told through 111 or the testing system, well, you haven't got these symptoms, so it's not COVID.
Thank you. And I understand from the materials that you've provided, your own statements and those on behalf of the group, that there were a number of meetings, not just the one we've mentioned with Ms Sturgeon, but a number of meetings with others, including Mr Swinney and Mr Youssef, subsequently, and you've referred to an extent to a reply that Mr Youssef was able to get you on that particular issue about symptoms. Broadly speaking, having looked at the materials for this, it seems to be our impression that the focus of these meetings, as far as the Scottish Government was concerned, was really about securing a Scottish inquiry.
Yes.
But that other than that particular issue about symptoms, you didn't seem to get very many answers to the many legitimate issues that you've listed. Would that be a fair summary?
Yes, I think that would be, yes.
So what that means, in effect, is that these questions still remain questions for the group,
Yes.
and that you are turning to this inquiry and, of course, the Scottish inquiry to try to find them out.
Yes.
Although you had been trying to get these answers for a long time, certainly at least since March 2021.
Yes.
There are a number of other areas that are covered in the statements, all of which have been taken into account, I can assure you, Mrs Morrison, the way that we've prepared this module and indeed others. I have no further questions for you, but I would like to offer you the opportunity to say what you would like. If there's anything else you'd like to add, please do so.
Thank you. Yes, we all want the same thing, which is we all want answers to make sure that this does not happen again. And it will only work if everyone speaking to the inquiry, particularly the politicians and the decision makers, are completely candid and they don't have selective amnesia, which seems to have been apparent in some of the previous issues. We need the truth and we need people to be honest. And if they made a mistake, be big enough to admit you made a mistake.
Thank you very much, Mrs Morrison. I have no further questions for you, lady.
Are there any co-participant questions?
There are no co-participant questions, as I understand.
No, I have no other questions, Mrs Morrison. Thank you so much for all your help. You mentioned earlier that you carried out the research to cope with your grief. Have you found it any comfort?
I have, my lady, thank you, yes.
Well, it's really helpful to the rest of us, obviously, because you raised some really important points. And between us, I hope the Scottish Inquiry and this inquiry can answer as many of them as possible. So with the help of people, what I found really interesting about the way you've described your experience and your loss of your wife, Jackie, is that you've been constructive. You haven't just been critical. You've been trying to ask questions to which there might be an answer. So I'm really grateful to you.
Thank you, my lady.
And this cough is not COVID, I promise. I've tested so many times, I run out of tests. But as those who've been following me in this inquiry will know, I do get coughs every so often. So thank you very much for your help.
Thank you, my lady.
Lady, the next witness will be Roseanne Foyer from the Scottish TUC, which my colleague Mr Tariq will be conducting. So we require to do a little bit of changing around, but it'll only take a few seconds.
Yep, that's fine. Thank you.
May I please call Roseanne Foyer?
I do solemnly,
I do solemnly,
sincerely and truly
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth, and nothing but the truth.
Thank you. Take a seat. Thank you.
Ms Foyer, thank you for your assistance to the inquiry to date. There are a few preliminary matters I want to talk about before we get to your evidence. Could you please keep your voice up and speak into the microphone so that the stenographer can hear you for the purpose of the transcript? And if any of my questions are unclear, please say so, and I will rephrase and ask the question again. The Scottish Trade Union Congress, the STUC, has provided the inquiry with a witness statement that's dated the 6th of July 2023. The statement is at INQ 000103536. Can we please have this on screen? This is a corporate statement that's been submitted on behalf of the STUC, and you're the author of the statement. Is that correct?
That is correct.
If we turn to the final page, which is page 33, there is a signature that is hidden behind personal data, but it would be your signature on this statement. Is that correct?
Yes, that's correct.
Are the contents of this statement true to the best of your knowledge and belief?
Yes, they are.
I now want to turn to the STUC's role during the pandemic. You're the General Secretary of the STUC, is that right?
Yes, I am.
And the STUC is a national lobbying, campaigning and coordinating body for trade unions in Scotland, is that correct?
That is correct.
And it represents over 540,000 members in Scotland, is that correct?
Yes, that's right.
And the organisation's campaigning and lobbying continued during the pandemic and covered a whole range of workers' rights issues and interests. Is that correct?
Yes, it is.
I want to discuss the issue of the Scottish Government's engagement with the STUC during the pandemic. Is it right that the STUC frequently had meetings with the Scottish Government throughout the pandemic?
Yes, we had a forum of engagement, and we met the Scottish Government twice weekly, specifically to bring the views and concerns of trade unions to the table. That reduced to once weekly, and then towards the end of the pandemic to monthly meetings. But we had other meetings out with those meetings with specific government ministers on a range of key issues.
And you personally attended a large number of these meetings, is that right?
Yes, I would say the vast majority of those meetings.
In general terms, what is the STUC's position on the Scottish Government's engagement with the STUC during the pandemic? For example, did you find that the Scottish Government was willing to listen to your concerns raised on behalf of your members?
Yeah, I would say that in general terms, I would describe the engagement that we had as intense and constructive. There was an established relationship there already. The Scottish Government do see trade unions as a key social partner, and they have a collaborative working approach. So we had an established relationship there already, but that relationship intensified during the pandemic because I think the Scottish Government recognised that we could be very helpful in giving them a real picture of what was happening in workplaces, and particularly in workplaces where key workers were working, delivering essential services across the economy.
I want to explore a little bit more about the engagement. Within the STUC's witness statement, you identify areas where you felt that there was insufficient engagement by the Scottish Government with the STUC. One example is the return of people to office working. Your position is that the Scottish Government consulted fully with the Scottish Chamber of Commerce, but had limited engagement with the STUC about that issue. Was this around the time that the lockdown restrictions were being eased in early summer 2020?
Yes, that was one of a number of examples where we were not shy in letting the Scottish Government know that we were unhappy not to be engaged. There are several examples of this that you will find throughout our evidence in the minutes of the meetings that we provided. So although the engagement and access was there, we did have issues fairly frequently about late engagement or the order of engagement. We always have an ethos as trade unionists that there should be nothing about us without us, and that workers' voices are very important, and that's actually part of Scottish Government's Fair Work framework. So we're not shy in letting the government know when we feel we have been not consulted fully enough.
I want to just focus on that issue that I raised, which is return of people to office working. And this is as we were easing out of the first lockdown in early summer 2020. At the time, the Scottish Government's strategy was to ease restrictions more gradually than the UK Government. And we've heard evidence in Module 2 that the UK Government was keen to get workers back into offices and into workplaces. What views did the STUC have on the Scottish Government's position on the return of workers to offices and workplaces at that time?
Well, we were cautious about it. We had clear safety concerns, and we had a set of criteria that we'd laid out, that we'd communicated with government that we felt should be met around areas like testing and making sure that proper safety guidance was in place in the workplaces that would be returning, and we worked to produce workplace-level public safety guidance for a range of key sectors. So there were some areas where we had concerns that things were moving too quickly, but I think overall we were quite critical of the approach being taken at the time by the UK Government, which we felt in some ways was undermining the more cautious approach of the Scottish Government, and that mixed signalling could be quite confusing to the public in Scotland. So, you know, we had times where the Scottish Government were saying that only certain types of workplace should be coming back, and there was a very gradual loosening of the restrictions, keeping a very close eye on the numbers of cases and those levels. And at the same time, we had announcements coming out of the UK Government, you know, the Eat Out to Help Out scheme and other things that were taking place where, you know, Boris Johnson made announcements about all non-essential workplaces. People should get back to work and get back into city centres. So there was a lot of differences there that we were really concerned about. But overall, although we had some, I mean, I think I put out a press release in July 2020 criticising Scottish Government for relaxing the 2 metre distancing down to one metre. So we were critical where we felt things were going too fast. But overall, we were very engaged with that approach, and we feel we were able to influence a more cautious approach by the Scottish Government to opening up.
There's a few questions, follow-up questions that I have. Going back to particularly the issue around return of workers back into offices and workspaces, you say that the Scottish Government had consulted fully with the Chamber of Commerce, but there was limited engagement with the STUC. Can you explain whose interests the Chamber of Commerce represents?
So the Chambers of Commerce is a business representative organisation. It represents all sorts of different businesses and employers. And there were a number of, I'm not sure to the very specific reference you're making, but there were a number of occasions where if we felt that communication had happened, with employers first, and there had been a document produced, for example, and we went in the room to put the view of workers in those sectors across, we would have taken issue with that. Because, the order of consultation is quite important. It's important that views are taken on in an open way, and often the best way to deal with issues like that can be through tripartite discussions at times with the government.
Now, we're discussing the period around the easing of the first lockdown. Mm-hmm. And within the STUC's statement, you say that there was many occasions where the STUC raised, and I think you say, serious concerns and had heated and robust exchanges with the Scottish Government. And one of those areas that you've identified in the statement is the easing of the first lockdown. And I think what I've seen is that the STUC had set out a criteria, and I think you've touched upon this in your oral evidence, that the STUC wanted to be met before we would come out of the first lockdown. And that included things such as capacity to supply PPE to non-essential workplaces, the continuation of the job retention scheme, and other support for those who could not work. And the STUC's position, as far as I understand it from the statement, is that it does not consider that there was sufficient measures in place to lift the first lockdown. What were the key measures that STUC considers were missing at the time the Scottish Government lifted the first national lockdown?
There were concerns that we had in relation to the provision of PPE. We had asked for surety that we felt there would be a much higher demand across different employment groups for PPE if more people were coming back into the workplace. And we felt that this needed to be made clear to us that that provision was in place, because we had real concerns, having seen the experience of workers who were in essential services, key workers who hadn't been able to access PPE during the first lockdown. What we didn't want to happen was that supply would be diverted in any way away from frontline services, given that the rest of the economy was open up and there would be demand for PPE. Other areas that we were concerned about was just making sure that there was appropriate safety guidance in place that had been worked on and put in place for different sectors of the economy, for workplaces that were returning to work. And we had concerns that employers were not following that guidance and that they were not putting appropriate safety measures in place based on some of the feedback that we'd received.
So these measures, is it my understanding that these measures were not put in place sufficiently or to STUC satisfaction at the time Scotland came out of the first national lockdown? Yes,
there was definitely gaps that we could see, but equally there were some areas that had been met. So there was a good sort of testing regime in place and a track and trace regime that they'd put in place. So these things were things that we welcomed, but we were also raising concerns. Another area that we were still very concerned about was the ability of workers to isolate. And we felt that there was a real gap in provision across the economy because the UK government's statutory sick pay was not adequate to allow workers in low-paid jobs to isolate if they were, told by the track and trace people that they had been, in contact with someone with symptoms. So that was something that we had a real concern about, and I think there is a document within the evidence where we wrote to the First Minister, welcoming some parts of what had been done, but raising some of the concerns that we had.
And do you think that the Scottish Government properly listened to the STUC's concerns prior to announcing the roadmap for the lifting of the first lockdown?
I think they did listen. I think they engaged. I don't think we always got everything we wanted, but I think there was a respectful engagement in most cases with the trade unions. I think to some extent issues like statutory sick pay were not in their gift to resolve. That was an issue the UK government needed to resolve, and I am aware that the Scottish Government did write to UK government ministers seeking funds to address some of those issues and you know, seeking for them to address some of those issues. So I think they definitely did listen. That doesn't mean they always acted. And I think that's just the nature of things, isn't it?
In terms of listening but not necessarily acting on some of the approaches advocated by the STUC around this time, what were the consequences of the Scottish Government not following the STUC's approach at the time of lifting of the first national lockdown? For your members, what were the consequences for them?
There were grave consequences potentially for our members. We had seen that, you know, you can tell from the figures around COVID, around the deaths, that there is definitely a link with death rates to the sort of work that people carried out, and that people who were involved in certain occupations were in more danger from the virus. And I think that we'd seen people in really frontline services on very low pay, really in the eye of the storm, and not receiving proper PPE, safety measures not being in place at the beginning. So we were very cautious and very aware of the fear of our members about getting up and going to work every day, and the idea that that was going to affect more workers who perhaps weren't delivering essential services. We had real concerns that there weren't appropriate safety measures in place, and that they could come under pressure to cut corners from unscrupulous employers. So there was a real caution there on our part. Our approach was very much safety first, that no worker should have their life put at risk in order to keep the economy going. You know, workers are not expendable.
One of the areas where we've seen kind of a theme of that in the evidence is that you raised concerns with the Scottish Government in relation to aviation workers. And the STUC has produced a note of a meeting it had with representatives of the Scottish Government on the 10th of July 2020. That note can be found at INQ 000107203. I don't intend to bring up that note, but it's a meeting that was attended by you, the Scottish Government's Minister for Business, Fair Work and Skills, Jamie Hepburn, and the Minister for Older People and Equalities, Christina McKelvey, amongst others. And in relation to aviation workers, the note says, and I quote, RF, and that's you, underlined the urgency in this area and of the real desperation for some deep and meaningful discussions with the Scottish Government and employers, but reiterated the disappointment in learning that discussions between the Scottish Government and employers had already been held without union involvement. So this is a note from July 2020, and it touches upon a theme that you've already addressed, which is sometimes the order of engagement wasn't correct.
Yeah.
And in terms of the time period, this was the period when Scotland was coming out of the lockdown more slowly than in England. Do you recall around that time what the concerns were of aviation workers?
Yes, there was a real concern about, frankly, a collapse in the industry, and that you know, many of these aviation had virtually, you know, closed down. It was in a very precarious position. So there was a real concern that, you know, those jobs would be required in the reopening of the economy. They were vital jobs when things went back to normal. However, the companies involved in delivering those very important services were in real trouble, and there was a potential retention issue that could happen in that sector. We very much welcomed the fact that the Scottish Government were looking at this. It was something our members had raised, but what we objected to was that they were perhaps going and speaking to employers. Some employers who did not take very seriously worker voice or recognise trade unions, and part of the agreed approach of the Scottish Government is to take a fair work approach to any public funding or support that they give. And a big component of the fair work approach is to respect worker voice. So the point we were making was that we really needed workers' voices to be in that room with discussions about what was needed. Actually, that came good in the end, because what we ended up with was that the STUC did end up in the room with employers in that sector and with the Scottish Government, leading discussions about investment in a skills package to upskill workers in that sector. And that actually helped resolve some of the issues that we saw when the economy reopened. You'll be aware that in some parts of the UK there was real difficulty with finding baggage handlers, etc., to reopen the airports. That wasn't quite so much of an issue in Scotland. I think some of the work that was done there actually helped further down the line.
The time period of this meeting and you raising your concerns is interesting because it's July 2020. And we know that there's some evidence that the second wave of infection in Scotland was caused by holidaymakers returning from continental Europe, in particular Spain. Did workers in the aviation industry raise concerns with the STUC about the number of people that were wanting to go abroad in summer 2020 and possibly bringing back the virus, and how this would expose workers to the virus or implicate them in outbreaks in Scotland?
The workers in the aviation sector were primarily concerned with the following health and safety guidance for them while they were in the workplace. We didn't have concerns so much raised around them not wishing to be in the workplace at that point. I think the overriding concern for a lot of workers in that sector was that there was about to be a complete collapse in their jobs. So there was a lot of concern about the security of their jobs at that point, and I think that underlines the issue that we're dealing with here, that we have people who, it's important to be able to have money and not be in financial constraints and to have a job. So there was a campaigning approach that we had, was that we were campaigning to save lives, but also to save jobs.
You touched earlier upon the issue of funding between the Scottish Government and the UK Government, and the STUC's position in its statement is that there was frustration that some actions that the Scottish Government agreed with the STUC as being essential could not be implemented by the Scottish Government due to the limits of devolution or a lack of funding or financial support from the UK Government. Can you provide examples of key actions that the STUC agreed with the Scottish Government but which could not be implemented because of devolution or the funding arrangements?
Yeah, I think that the statutory sick pay example is actually one of the most important ones. And I think there is an issue around, Scottish Government through devolution has a responsibility to deliver health, local government, education, all these essential services that were very crucial during the pandemic, but they don't have the budget control. So there had been, a decade of austerity cuts taking place there. And similarly, we had a situation with, we were in control of public safety. They were issuing guidance to the people of Scotland saying that, if you're tracked and traced as being in contact with someone that had the virus, you need to isolate for so many days. But if people are materially unable to follow that guidance because it would cause them severe financial hardship, then we have a situation where the UK Government's policy was undermining the Scottish Government's devolved policy and responsibilities. So, at the end of the day, there's nothing the Scottish Government can do to change statutory sick pay or those sorts of arrangements. They don't have the budgets to undertake that scale of policy. So we had a situation where, you know, we know Scottish Government wrote to UK Government. They agreed with us that something should be done to improve statutory sick pay, but we didn't get any shift on that, unfortunately.
That's an area that the inquiry will explore in more detail with other witnesses. But did you ever have the impression that the Scottish Government could have done more on some of the matters that you were pushing, but it was easier to attribute blame to the UK Government for not being able to take some of these actions forwards?
I often get that impression in all sorts of areas. The STUC is very active in pushing the Scottish Government just generally to use all of its devolved powers, particularly its fiscal powers, in terms of more progressive taxation, to allow them the budgets to do more. But I also have to acknowledge that it's difficult to do that, and that the powers they have fiscally are limited. And you know, it's very hard for the Scottish Government to overcome 10 years of austerity and budget cuts to public services. It's very hard for the Scottish Government to go beyond their devolved responsibilities. One thing I think the Scottish Government did do when we raised particular concerns about workers in the care sector, because you had a sort of perfect storm, I think, in the care sector, where you had workers on very low pay who were crucially in touch with some of the most vulnerable people when it came to the virus, and providing personal care to them, whether it was in their homes or in care homes. And these workers, in many cases, did not have access to appropriate levels of sick pay. The Scottish Government did very early on create a fund from their own budget. I think it was launched in June. A social care fund that allowed social care workers, whether they be agency workers or working in the private, voluntary or public sector, to access sick pay to cover their pay in order to allow them to isolate. So that was one example of where I feel they did act, and they had limited ability because of budgetary constraints to do that. But that was it was almost like they picked the most important area they could, knowing their constraints, when actually what we needed was that to be happening right across all workers for them to be able to isolate properly.
My question was around specific areas or actions that you agreed with the Scottish Government, where you felt, or they had the impression, that maybe the Scottish Government didn't push the matter forward and it was easier to attribute blame to the UK Government. Is there anything of that nature during the Scottish Government's decision-making in the pandemic that you can point to?
I don't think that there's anything I would specifically point to and say, you know, no, that was complete nonsense that they were saying this would be difficult to enact. I think I think I could see there was reasonable reasons, budgetary constraints or otherwise, why in some cases they weren't able to do things, and I don't think that they were making that up. I think it was the political reality of the way devolution works, that there were certain things they weren't able to do that we were calling to happen. So I'm not sure I could point to anything that really stuck out as being something where I thought they were being disingenuous in saying that they were constrained. I think the constraints were very real.
I'm now coming towards the final topic, which is I just want to touch upon in terms of impact on minorities. Is it correct that the STUC carried out surveys in respect of the impact of the pandemic on minorities such as ethnic minorities and disabled workers?
Yes, it is.
Generally, what did these surveys show about the impact of the Scottish Government's decision-making on minority groups?
Well, one of the concerning things that our survey showed was that there was a disproportionate impact on people from BAME communities who tended more often to be working in roles that would place them in greater exposure to the virus, so sort of low-paid roles within, health social care and areas like that. The other issue that became clear was that for a lot of disabled workers there were serious issues emerging, both in terms of not enough provision in the reopening of the economy to workers who might have specific needs and be shielding, but also things like a lot of people losing the reasonable adjustments that they had in the workplace when they were shifted to home working, and adequate provision not following them into their home working at times. And also a lot of our surveys showed, higher rates of mental health, people experiencing poor mental health, a higher rate of anxiety, I would say, among people from groups such as disabled workers or the BAME community.
Did you raise these concerns with the Scottish Government at the time? And if so,
Yes.
did the Scottish Government properly engage with you on these concerns? And did you see that then being actioned in the Scottish Government's decision-making?
So quite early on, our Black Workers Committee wrote a letter to the First Minister, an open letter, raising a number of these issues and asking the Scottish Government to put more priority into collecting data relating to Black and minority ethnic communities and the impacts of the virus on them. And that's something that they did take steps to try and rectify and start to work on. Some of the issues that we were raising were very systemic, though, and related to the fact that people from these communities are more likely to be in lower paid roles, more precarious roles, and areas that were more likely to be disproportionately impacted by the virus.
And I want to conclude by asking you about potential lessons learned by the STUC about the Scottish Government's decision-making during the pandemic. Do you believe that the Scottish Government's decision-making in relation to the concerns of workers, including engagement with the STUC, could be improved in a future pandemic situation? And if your answer is yes, how?
So I think that definitely there could be improvements in decision-making. I think that what we've seen is that cuts to essential services, that prolonged period of cuts and that austerity that was implemented by the Scottish Government, it may have been caused by the UK Government, but it was certainly followed and implemented by the Scottish Government. It left services with no resilience and very ill-equipped to meet the needs of the pandemic at a time of crisis. I think that PPE reserves are something that must be taken into account in the future. I think that we need to overhaul and adequately fund our whole health and social care. It's particularly the social care side of our public services, and that's ongoing work that we're now engaged in with the Scottish Government. And I think that there were key lessons about enforcement agencies. So, for example, the Health and Safety Executive, which is a UK body, I feel did not engage appropriately with the workplace guidance, safety guidance that was issued by the Scottish Government under its public health responsibilities. And I think that was a missed opportunity to disseminate this information effectively to employers and workers. What tended to happen was it was union reps in areas where we're well organised that were using these tools, but what about areas where there isn't a trade union? So that was something I think we need to think about and think about, how our devolution works and the responsibilities of Scottish Government. And I also think that given the public health data shows that there is a clear link between worker occupation groupings and the likelihood to contract and indeed have fatal consequences with this virus, that we need to start looking at COVID as being an industrial injury and see it through that lens. So I think a lesson that we need to learn for the future is that, for the people who suffered long-term consequences such as death or long COVID and their families, this should be treated in an industrial injury in the same way as people who have asbestos-related injuries or long-term health conditions are treated.
The final question from me is just giving you an opportunity to say if there's anything further that you want to add to your evidence.
Yes, thank you. And I would just want to say that for the STUC, the people whose story most deserves to be heard in this inquiry is the key workers who put themselves and their families at risk to provide essential services at a time of real crisis. Many of those workers were on poverty pay rates. The majority were women. And disproportionately they came from black and ethnic minority backgrounds. And the sad reality is that too many of those workers lost their lives protecting us, but I don't think we protected them enough. And our testimony to the inquiry makes clear that years of brutal austerity has fundamentally altered our public services with lethal consequences. Workers across our economy, especially in health and social care, were really dangerously exposed to the virus through a deadly combination of understaffing, PPE shortages and poor pandemic planning from central government, with a health and safety executive that was hamstrung by budget cuts and with limits on devolution. And the Scottish Government were unable to effectively legislate on employment and health and safety matters. And working people were really caught in the crossfire of that, and I think there were grave results of that. So I think lessons really do need to be learned. I welcome this inquiry and I welcome our opportunity to contribute to it. Governments can't repeat the same mistakes that led to, unfortunately, some very unnecessary and tragic deaths of many workers throughout our country.
Ms Foyer, thank you for your evidence. There's no further questions, my lady, from me.
No, I have no further questions. Thank you very much indeed. We're very grateful to you. We'll break now because I think we need to make arrangements for the next witness. So I shall return at 11:30.
Obliged.
Miss Irish. Well, may I please call Dr. Jim Elder-Woodward, OBE.
Can you put your hand on the book and repeat after me? I swear by Almighty God.
I swear by Almighty God
That the evidence I shall give.
The evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Thank you. Would you stand, please? Repeat after me. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth. Thank you so much.
Just to explain to people, we've asked for Dr. Elder-Woodward's assistant to be sworn in, just in case she has to help in any way with any communication issues.
Thank you, my lady.
Not at all.
Thank you very much. Mr. Elder-Woodward, you've provided, Dr. Elder-Woodward, I apologise. You've provided two statements to the inquiry, one in your capacity as co-convener of Inclusion Scotland and a supplementary personal statement. The reference for the Inclusion Scotland statement is INQ 000371664. That's brought up on that. Hopefully you'll see that on your screen in front of you, and it will be a familiar document to you.
Yes.
And on page 23 of that, you've signed that statement on behalf of yourself and Inclusion Scotland, haven't you?
Yes.
You've also provided a supplementary statement. The INQ reference, I'm afraid, don't have to hand immediately, but we'll have it in a moment. And that is a personal statement in which you exhibit a number of documents setting out your own personal lived experience of the pandemic. Is that right?
Yes.
We'll be looking at both aspects of that in the course of your evidence today. In the course of your evidence, if there's anything that I say is not clear, please do just ask me to repeat myself. And of course, if there's any elements that you'd like your assistant to help you with, please do so. If we turn first to your personal experiences of the pandemic, if we may, you suffer from you were until 1999 a senior social work officer at Glasgow City Council. That's right, isn't it?
Yes.
And during your time with local government, were you involved in establishing indirect and direct payments in Scotland?
Yes, I was.
And were you also, did you also assist in the development of the Glasgow Centre for Inclusive Living?
Yes, I did.
And so you therefore had quite the experience of dealing with bureaucracy and accessing services, because you'd done that for other people as well, hadn't you?
Yes.
You retired, of course, long before the pandemic started, but you, as part of your needs, had a package in place for support. Is that right?
Yes, it's a 24-hour package.
24-hour
Day and night.
with personal assistance assisting you for the whole 24 hours a day.
I've got a team of 5 part-time personal assistants who I manage myself.
You were given a sort of budget to employ assistants to cover your needs within that budget.
Yes, and that is one of them.
Yes. And when lockdown came, 2 of your personal assistants were unable to continue assisting you due to their own personal circumstances. Is that
yes, that's right.
And in terms of having control of the budget for employing those personal assistants, how did that cause difficulties for you?
Well, to begin with, I didn't know where the money would come from to pay for their self-isolation, because I had to find additional support. I also cut the hours of support because there was insufficient support available.
So
I was fortunate enough to receive support from the Independent Living Fund. I don't know if you heard of that, but there's a fund whereby people receiving money from a local authority can go to this fund for additional money. And although I wasn't getting much additional support from my local authority, the fund was able to give me more money to pay for the fellow of the people taking self-isolation. Did that answer the point?
So when you, having reduced your own personal assistant support, you effectively had to seek assistance elsewhere to try and maintain some level of support that would keep you safe and keep you as healthy as you could be.
Yes.
And in circumstances where you were responsible for employing your own carers and having to put, personal assistants and having to put 2 on furlough or statutory sick pay, did that in itself cause you stress and concern and extra workload at quite the time when you didn't need it?
Yes. I'm afraid the person that came in to help, he stole some money and jewelry from the house. So I was under extreme stress because the police couldn't help me. And I had a bit of a collapse, at which time my nephew took control of my support package.
And you suffered as, both sort of mentally and physically as a result of this stress, didn't you?
Yes, I did.
And you were able, as a result of your previous knowledge and your previous role at Glasgow City Council, and as a result of your knowledge and experience through Inclusion Scotland, you're a very adept, knowledgeable expert in accessing services and advocating for not only your own rights, but for those other people who require assistance.
Yes, but even so, I found it very difficult during the COVID, because everything was locked down. So even I couldn't find the support I needed. With all my professional and academic contacts, I still couldn't get the support I needed.
And if I may read from a document you've produced for this inquiry, you say, "But I often wonder, what about those who may not be so blessed by these resources? What efforts are being made to develop their agency and social networks? Doesn't this pandemic highlight the need to develop peer advocacy and group identity, peer support?"
There has been a long campaign on behalf of the movement that we need more peer support, but peer support is much more effective than non-peer support, because having a peer with empathy and knowledge of the situation of the person.
And that, if we move therefore in that very vein onto your work with Inclusion Scotland, is it right that you're the co-convener of Inclusion Scotland?
Yes, I am.
And you've been in that post since November 2023, so after the pandemic, but you have been a board member since 2005.
Yes.
And in that role, you are responsible for various things, including overseeing the governance of the organisation and representing the board at meetings, including with Scottish Government and others. Is that right?
Yes.
And just to assist the inquiry and my lady and those listening, Inclusion Scotland is a registered charity. It's a disabled people's organisation, and it is led, therefore, by people who are disabled themselves or deaf or hard of hearing. Is that right?
Yes, that's correct.
And so is it right to say that it is both a support network for people and an advocacy network seeking to achieve change in government and to represent individuals' rights?
It's a support of local disabled people's organisations. We don't support individuals. We support the local and national organisations. But we do have 2 programmes funded by the government to support people in employment and to support people to enter the political system. To join political parties or to stand for local and national elections. We have a team of people helping them to stand for elections.
And the focus of the groups within Inclusion Scotland, the operational focus of Inclusion Scotland is disabled people within the community rather than, for example, in residential care homes and the like.
In the majority, yes.
Inclusion Scotland, would you say, worked closely with Scottish Government and others throughout, prior to the pandemic, as a advocacy service and a representative service in seeking to influence policy in government?
We found the engagement very open.
And you found that there was a level of proper access and two-way dialogues. Is that fair?
No. The government isn't one entity. There's several departments and several people within the departments. So we had some good relations and some not so good relations within the government, if that's understood.
It's no doubt part and parcel of the enormous machinery of government that's...
Exactly.
And as part of the engagement with government, sometimes good, sometimes less good, part of that was Inclusion Scotland actively seeking to inform government, different parts about different things, no doubt, about things such as structural discrimination, barriers to access on part of disabled people, and the denial, you say in your statement, of human rights that disabled people face.
Yes.
In your witness statement, for the corporate statement, you set out a number of reference, for example, to the UN committees. And is that the sort of thing with international knowledge brought to bear and informing the Scottish Government about that Inclusion Scotland were keen to ensure was happening?
Yeah, we have links with the colleagues in Europe as well as internationally. So there's an international movement of GPOs, a European network of GPOs and a Scottish network of GPOs. And we have links with all three.
So you could bring those networks together to influence and inform Scottish Government about these matters. And you say in your statement at paragraph 9, I'll just read it out because I think it's an element of your statement that you're particularly keen to draw out. Going into the pandemic, disabled people did not enjoy the human rights set out in the UN Convention on the Rights of Persons with Disabilities. Instead, disabled people already experienced unequal outcomes and lacked the support and resilience to deal with such an emergency. it was transparently clear that this was compounded by the negative impacts of Covid-19 and core decisions taken by Scottish Government.
Yes.
Is that something that you found particularly important to bring out?
Yes, pre-pandemic, the people were in a dire state of being not supported by the community, not supported by the government, having their benefits reduced, having their social care reduced, and the whole reduction of services in the austerity period. We were in a crisis situation pre-pandemic.
And that crisis was multifactorial, wasn't it? So there would be issues about access to suitable housing, accessible housing, issues within the home, within people's homes that exacerbated their disabilities.
Some people couldn't even go to the toilet in their homes. The kitchens were inaccessible to other people, and they were waiting long time to be rehoused. So people were imprisoned even within their own dwelling.
Even before the pandemic.
Even before the pandemic.
And then the pandemic came along and worsened the situation yet further. Is
Absolutely.
That right? Inclusion Scotland carried out a survey in April 2020, didn't they?
Yes.
So very early on in the pandemic, and you presented, the Inclusion Scotland produced a report based on that survey of 800 members. And in that survey, which is, we don't need to bring this up on screen, but you comment on a couple of the findings in your statement. For the reference for the transcript is INQ 000366004. And you say, respondents say they felt abandoned. A number reported feeling suicidal. They talked of isolation and loneliness, the impact of the loss of essential social care supported by independent living, difficulties accessing foods and necessities, fears about being denied treatment, and the involuntary imposition of do not attempt cardiopulmonary resuscitation.
Yeah, that's right.
And both in terms of the survey findings, also these were presumably matters that were being brought to the attention of Inclusion Scotland on an anecdotal basis as well.
Yes, and we informed the government of their situation. So we got this information from the people and we gave it to the government.
Because in the context of lockdown, as you've already described in your own personal stories, but that your personal story was sadly replicated across many other individuals as well who had issues accessing their personal assistance. They were unable to access, they had their support withdrawn because of lockdown. They had issues accessing medication, washing, food preparation, all things that would ordinarily, hopefully, form part of a package.
Shopping was a problem. I was the emphasis by the government on using digital information because many disabled people, because of their poverty, do not have access to the World Wide. So the reliance by the government on digital information.
So the isolate
hampered the knowledge of disabled people.
The isolation that existed was compounded, wasn't it, because of the lack of ability in some circumstances to access the data that was being, or the information that was being provided by the government. Is that right?
Yes.
And therefore, both access to the knowledge of what was happening was an issue, but also access to the healthcare generally and support was an issue.
Yes, and also the lack of being able to have some interpretation of the information. There was no advisory service which could interpret the information to the individual situation, particularly for those with intellectual disabilities. The information wasn't an easy read, nor were there any facilities to help people interpret the information to their own situation.
So it was a dual issue. People couldn't access the information themselves directly, and because of the withdrawal of support, they couldn't access the support that they needed to interpret that information. And turning to sort of some of the other practical impacts on those with disabilities and that Inclusion Scotland speak to, were there issues with, for instance, access to food and medication as a result of the imposition of lockdown and other non-pharmaceutical interventions?
That was the case. That was the case in many situations. In others, they felt that they had to come out of the lockdown to go into the community to get aid support and to get medication. The other problem some people had was that they couldn't get access to the dietary requirements that we needed for their impairment. The availability of special diets was a problem.
So people with disabilities were having to break shielding, for example, despite their own vulnerabilities, in order to access services because the support that had previously been in place was no longer there, and in order to get their food, their specialist medication, the like. They were having to put themselves at further risk. Is that right?
Yes, some people reverted to the social media to get help. Like, I'm talking about Twitter and that sort of thing, to see if they can find food or medication in the social media area.
And then if we look at other aspects that you've mentioned in the corporate report, a corporate statement, I'm sorry, you talk about the impact on families and education. And you say, paragraph 34 of your witness statement, those caring for disabled children highlighted the impact of the loss of specialist educational support and respite. Parents with disabled children, including parents who were disabled people themselves, struggled with the additional strain of having to educate them at home without the skills or tools necessary. There are an estimated 10,000 children in Scotland with complex additional support needs prior to the pandemic. Many lost some or all of the specialist education and support they relied on. So this is a sort of twofold element to lockdown and schools closing and support being withdrawn that you say hit those with disabled children particularly hard because they lost both the schooling and the special educational needs support that is inherent in schooling itself.
Yeah, the lack of schooling or the lack of support, especially for children with complex needs, particularly psychological needs. That added to the stress of the parents because they had to deal with very difficult children 24 hours a day, and there was no respite for them.
And would you say that was therefore compounded as well, particularly in the physical circumstances of lockdown, where it's not just there's no respite, there's much closer. You also talk in your statement about the impact of reasonable adjustments on those in the disabled community. For instance, in terms of face coverings, for those people with difficulties, with communication difficulties, if someone was deaf, relied upon lip reading, for instance, that the presence of face masks, of course, would cause them greater difficulty in accessing society.
That is true. Very few people use the plastic mask which you could see through. Those windows in the mask help people with deaf and otherwise deaf, but very, very few people, even those working with deaf people, didn't use that accommodation.
And you say some frontline service providers refuse to step back and remove their mask or to use an alternative means of communication like pen and paper.
Yeah, that was true.
So simple intervention, or simple adjustments that your organisation found were simply not being made. Is that right?
Yes.
And then, of course, for some people who were vulnerable as well, who were vulnerable to the infection with COVID, fear about people not following the rules, did that have an impact on social integration and people being able to access their community?
Yes, there were instances where disabled people refused support for fear of being infected. But that is the case. There's also the case that Professor Shakespeare and Watson brought up in Module 2, and people, particularly with learning disabilities, were housed in group accommodation, which facilitated the transfer of the virus because they were living in such close proximity to one another.
Excuse me. We've spoken briefly already about the contact that Inclusion Scotland had with Scottish Government ministers and officials. You say at paragraph 53 of your statement, despite it having been abundantly clear to the Scottish Government that disabled people would be gravely and disproportionately affected by Covid-19 and actions taken to mitigate it, this previously good level of engagement reduced suddenly as the pandemic took hold. This was presumably so that the Scottish Government could reset to deal with the emergency.
Yes.
How long did it take until Inclusion Scotland became more involved again with Scottish Government?
I find that difficult to answer because it didn't until after the pandemic came about. I can't give you an exact time, but it was after the pandemic that we were just beginning to pick up where we were pre-pandemic. And that's still an ongoing scenario, I'm afraid.
Now, in your statement, you do go through some of the contact you have with Scottish Government. I won't take you through it. For those who would like to look at it, it's from paragraph 51 onwards to 101, 102. All of those, although there was the contact with Scottish Government obviously had fallen away and you felt there was less influence, is it fair to say, is it your evidence that despite the fact that that Inclusion Scotland prior to the pandemic had been closely involved, and despite the offers and the attempts to engage with Scottish Government throughout the pandemic, even in all those circumstances, the outcomes didn't reflect the efforts that Inclusion Scotland had put in to improving inclusion, improving Scottish Government knowledge about the particular challenges facing the disabled community?
If I may, my lady, answer that in more broad terms, rather philosophical terms, the procedure of engagement, whereby the engagement is started and ended by authority. It's up to the authority to decide whether they want to engage or not. We can press them to talk to us, but it's their decision to start and it's their decision to end. So there's the process whereby the initiation and conclusion is in the hands of powerful people. Then there's where engagement starts. Does it start at the beginning of the process or the end? We would welcome that we were involved at the beginning and not the end. Then there's the resourcing of us. We need resources in order to engage with the authority. Then there's the audit. What is the audit of what is the outcome of our involvement? And that process, council, is very difficult to assess.
And
does that answer your question?
it does. Do you think that the Scottish Government should have turned more rapidly to the DPOs and into Inclusion Scotland when it was clear that the virus was going to change lives and allow you to influence and give your advice and information to Scottish Government?
We gave them ample opportunity, we gave them ample information which we could have used earlier than when they did. And I think if you want engagement to flourish, we need to be involved right at the outset, not at the end of the decision-making process.
You say in your statement, we would have informed their draft decision-making about the likely impacts for disabled people and the specific support that would be required before the negative impacts took effect. Do you say they missed that opportunity?
Absolutely.
You also say, it's paragraph 108 of your statement, the Equality Unit Disability Roundtable and the Social Renewal Advisory Board were helpful in this regard, but could be classed as too little, too late. Even so, our input was not always addressed to the extent and with the haste required by disabled people.
Yes, that's what I talk about the audit. There were no audits or involvement.
And to the extent that there was engagement, it was too late, and it was too.
The engagement was too late, and we never knew what impact our involvement was, but we couldn't ascertain the outcome, which was attributed, which could be attributed to our engagement.
So you never were able to find out whether you were able to. You didn't see the input that Inclusion Scotland were putting into things reflected in the output of Scottish Government.
Well, that's true generally. There was one or two instances, my lady, where we could see an outcome. And that the government, after listening to us, the government gave local authorities £100 million to restart care packages. But there was no audit where that money went to. There was no transparency about where that money went to, because we didn't see any care packages being reopened. So although the government was listening to us, the local authority delivery service was not.
And turning just finally to the future recommendations that Inclusion Scotland have suggested, they're at paragraph 111 to 116 of your statement. And do you say that DPOs should be involved in emergency planning?
Yes. There should be nothing about us without us. That, my lady, is a motto. It should be nothing about us without us.
And there are a series of other recommendations. I won't take you through them, but I've just given the reference for the transcript. Dr. Elder-Woodward, is there anything else you would like to say?
Just a couple of things. First of all, my lady, we would have been more resilient to the COVID if our social economic rights had been delivered. The fact was that we were bereft of our social and economic rights that made us more, I don't like the term vulnerable, more susceptible to the COVID pandemic. The other thing we haven't talked about is the DNRs, and the DNRs we felt, people felt that they were not wanted. The society didn't want them for the DNRs. that could be a utilitarian approach to coping with COVID. But we would rather the commander's motto, leave no one behind. That motto is true for arming people under fire. It should also be true for society in dealing with pandemics. Leave no one behind. Thanks, my lady.
Very good motto.
Thank you, Council.
My lady, there are no CP questions. I do have the reference for the supplementary statement to be read into the record, with your leave. That's INQ 000397354.
Thank you very much. Thank you very much indeed, Dr. Elder-Woodward. I'm really sorry to hear some of what you've had to say, obviously, but you've been really helpful and I'm very grateful to you. Don't worry if on the journey home you think of something that you wish you'd said. I've got the written statement and I take into account all the written material, not just what I hear here in the oral hearings. And also you have the advantage of being represented by very experienced King's Counsel, Mr. Freedman, so he'll make sure that anything you want to be put before the inquiry will be put before the inquiry. So thank you very much indeed for your help.
Lady, can I thank you for giving me the opportunity to come today. Thank you so much. Thank
you. Right, I think I have to rise now for 5 minutes. I think everybody else stays, if they want to stay. I go for 5 minutes. Yes. I shall return.
Good afternoon, my lady. The next witnesses, there will be two witnesses giving evidence together, Mr. Roger Halliday and Mr. Scott Heald.
Professor Halliday, if you can just repeat after me. I do solemnly.
I do solemnly.
Sincerely and truly.
Sincerely and truly.
Declare and affirm.
Declare and affirm.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth. The whole truth.
And nothing but the truth.
And nothing but the truth.
I swear by Almighty God
that the evidence I shall give
shall be the truth,
the
whole truth, and nothing but the truth.
You are Scott Heald.
I am.
And you are David Halliday.
Roger Halliday.
Could I just ask you, first of all, to try and speak into the microphones, but as you're giving evidence together, we'll try to avoid you speaking over each other. I know you've got a lot of interesting things to tell us. I'll try and direct my questions to each of you individually, but if you both have things to contribute in certain areas, I'd very much like to hear from both of you on those matters to the extent appropriate. Thank you. Mr. Heald, you have provided a witness statement dated the 11th of October of this year to the inquiry, is that right?
That's right.
And the inquiry reference is INQ 000315514. A copy has just come up. If we could just go to the page 28. Internal, so a couple of pages before that, I think. Yeah, that one there. There you have signed the statement, is that correct?
That's correct.
And as far as you're concerned, does the content of that statement remain true and accurate?
It does.
And Mr. Halliday, similarly, you have provided a statement to the inquiry dated the 15th of November of this year, is that correct?
Correct.
That's the statement there. It's under reference INQ 000274011. And again, if we could go to the final page. And you see there, you've signed the statement, is that correct?
Absolutely.
And does this statement remain true and accurate as far as you're concerned?
It does.
May I also ask my lady simply to read into the record, we'll come later to some slides which are being put together relating to statistical matters, the reference for that being INQ 000274150, simply so that others can look at that if they consider it appropriate. Could I start with you, Mr Halliday, just to get some details? You were the Chief Statistician for Scotland from 2011 to the 25th of April 2022, when you left the Scottish Government to become the Chief Executive of Research Data Scotland. Is that correct?
Correct.
And during the pandemic, you held a number of roles in addition to being Chief Statistician. Perhaps most relevantly for our inquiry, you were the joint head of the COVID analytical team. Is that correct?
Correct.
And I understand that the joint head of that team was a lady named Audrey McDougall.
Yeah, that's right.
That's right. And you were responsible for the quality and accuracy of the data that was published by the Scottish Government. Is that correct?
That's absolutely correct.
And as part of your role, I understand that you were a member of a group that we've heard a little bit about already, the Scottish Government COVID Advisory Group. Is that correct?
Yeah, from until January 2021.
And you're a member of some other groups, something called the Scottish COVID Chiefs Group until April 2022.
That's right.
And something called the Scottish COVID Data and Intelligence Network Delivery Group. Is that correct?
That's right.
And you also attended meetings of a group that we've heard of called SCORE.
From time to time. I wasn't a standing member.
Thank you. And you also attended cabinet meetings.
Again, from time to time.
How was it determined when you would attend SCORE or cabinet meetings?
When there was relevant evidence and data that I or my team collated and that was relevant to the agenda of those meetings.
Thank you. Mr Heal, if we could just run through similar background to you. Over the course of the period on which this module is focused, you were the Associate Director and Head of Profession for Statistics at the Information Statistics Division, which was incorporated into PHS when it became operational in April 2020. Is that correct?
That's correct.
And you continued when PHS was formed and became the Interim Contact Tracing Director from May 2020 to January 2021.
That's correct.
You were the Chief Officer from January 2021 to May 2021.
That's correct.
And since June 2021, your title has been Director for Data and Digital Information.
Data and Digital Innovation.
Innovation.
Yeah.
And also, between January 2020 and April 2022, you were the Head of Profession for Statistics at PHS.
That's correct.
And you were accountable, as I understand it, for the statistical methods, standards and timing of statistical release from PHS.
That's correct.
And you say in your statement that whilst part of your role involved advising Scottish Government officials, the final decision regarding the publication of PHS statistical material lay with you.
That's correct.
And that was the case throughout the pandemic.
That was, yeah.
Thank you very much. Could I just ask you, I'll direct the question to Mr Halliday first, then Mr Heal will have something to say about this. Some questions broadly about, as far as the Scottish Government response to the pandemic was concerned, the purposes for which the various data sets that you were involved in collating and analysing and presenting, what the purposes of those might be. Could you tell me whether the purposes for which data was being collected during the course of the pandemic changed as the pandemic progressed? And if so, in what ways, Mr Halliday?
Well, I would say yes, that did happen. So I would say initially it was the data that we had around infections, hospitalizations and deaths we used partly to communicate to the public. They were partly used for decision-making as part of modelling. And I would say that, and other reasons for, in terms of managing the business and decisions of the government, I would say as we went on, though, the nature of those decisions would need to change. So, for example, some of those data sets formed part of the decision-making or the evidence for decision-making as part of the levels approach, for example. Mm-hmm. So I guess that, yeah, I would start off by saying that.
So as far as the levels approach was concerned, about which we heard a little yesterday, would it be fair to presume that the data that you required became more localised, given the fact that the levels approach involved local area levels being applied?
Indeed, and I guess the interest from members of the public as the COVID pandemic sort of went on, again, became more intense, and the demand for local area data by the public certainly increased during that time as well.
And in the very early stages of the pandemic, would it be fair to say that there was a limited amount of data that was available?
It certainly developed the amount of data, though we had, in a large area, particularly for Public Health Scotland, they had existing data systems that served us well. But in many areas, what we did was we adjusted either the data collected, so that it was looking, for example, at schools and looking at the impact on staff and students at schools and attendance and absence, or at the frequency of the data that was collected. So the nature of the data collection changed in response to the need for government information and to support decisions.
Mr. Heald, was there any perspective you have to add to that?
Yeah, I mean, I think I would agree with the points that Roger has made. I think what I would reflect is that the data that we held and the data that we published, so Public Health Scotland had a role to make the data public, changed over the course of the pandemic. So as Roger says, infections, hospitalisations, deaths, very much the focus at the start. But as the pandemic and the approach to the pandemic changed, so things like vaccinations, it became really important that we released data on vaccinations into the public domain. We also released data on aspects of the test and protect system, just so people can understand how that was operating. So I would say that we adapted what we published as the pandemic progressed. And your point about data at local level being important, so one of the key differences between the data that was published by Scottish Government, which tended to be headline Scotland numbers, and the data published by Public Health Scotland each day, was that we provided more granular data at a more local level. And I think one of the successes for us was the Public Health Scotland COVID dashboard, which had data to I guess, locality levels, so very low levels of geography, that allowed users to log in and see kind of how the pandemic was affecting their local areas.
We'll come back to it in a bit more detail, but could you remind us, because I'm sure everyone at one stage was aware, what the COVID-19 dashboard was?
Yeah, so the COVID-19 dashboard was basically a tool that Public Health Scotland updated every day that contained data and statistics about the pandemic, so updating for the most up-to-date figures. It presented data at Scotland level, so similar to what was published by Scottish Government, but also published data at the more granular local level. And that was the key difference between what Public Health Scotland published each day and what Government did. Just to add alongside that, we also published the data in what we call open data format, which was we released the data so that others could pick up the data and use it. And that open data also fed into the UK COVID dashboard, which the UK Health Security Agency also published. So there was a real stream of data going out each day. So
do I take it from that then that you were feeding the Scottish data into the UK dashboard,
yes,
as well as publishing it separately as a Scottish entity?
Yes.
Thank you. You've anticipated the area I wanted to go to next, which was the interplay really between both of your roles, one within Scottish Government and one within PHS. Yeah. Our understanding from the material is that both Scottish Government and PHS published daily statistical updates throughout the pandemic. And the Scottish Government published data, included some data provided by PHS, as you've already said, Mr. Heald, and other sources as well, which we understand to include things like the National Records of Scotland. Is it correct to say that overall the Scottish Government published a daily update on the internet from March 2020 until April 2022, and that PHS produced a daily dashboard? Is that correct?
That's correct. And what we took was the judgment that actually we wanted to make it as easy as possible for people to access the headline statistics that were of significant interest. And so by bringing that together in a single place, we helped to achieve that.
Thank you. And do I take it to be the case then that the data that was produced by PHS was available to Scottish Government and formed a subset of the overall material that was published by the Scottish Government?
That's pretty much correct. We didn't. The distinction is in the local area data. The data that was published on the Scottish Government website was national data, and then Public Health Scotland produced the dashboard, which showed that local area data.
So just to understand that, the position is that Scottish Government would draw on PHS data, it would extract from that for publication purposes certain elements of it, but not necessarily with the granularity that Mr. Heald referred to. Is that correct?
That's correct.
And I'd just like to separate out two concepts here. One is the question of publication of the data for public information, which you both referred to, and one is the data that would be available for various people within Scottish Government to be able to process, analyse and ultimately inform high-level decisions with which this module is concerned. So the position is that all of the PHS data would be part of a wider suite of data available to the Scottish Government for that decision-making purpose. Is that correct?
That's correct.
But what you've both spoken about, I think, is that publication was a separate matter because thought was put by both the Scottish Government and PHS into what would be appropriate to release into the public domain, which might not be everything that would be compiled.
Correct.
Thank you. One of the decision-making bodies with which we are concerned, or bodies which is connected to decision-making, is one we've mentioned already, the Scottish Government Resilience Room. Mr. Halliday, you've told us that you would on occasion be asked to provide information to that. I understand that statistical and data-related information was fed into that body by a series of documents which were known as SCORE SITREPs. Is that correct?
That's right.
And I understand that these were documents which were provided in connection with SCORE meetings where decisions might at least be discussed, and that the data that was provided in the SITREP was assimilated and put together to try and assist with that decision-making process.
The data was provided on a daily basis or updated on a daily basis. So, well, some of the elements of the report were updated on a daily basis. Some of it was weekly or less frequent. But updates were given every day to make sure that the information that was available to the meetings and more broadly that there was a clear, definitive set of data for government to make decisions upon.
If I could have up, please, a document under number INQ 000214776. Thank you very much. This is an example of one of the SCORE SITREPs. Is that correct, Mr. Halliday?
That's right.
And we see from the top corner that this is from June 2020. I wonder whether we might look through this document to a certain extent, and you might be able to tell us a little bit. For example, if we were able to go to page 3 of the document, there is a colourful arrangement there with a lot of information on a single page under the title Key Indicators, which appears to be split into 4 separate boxes. Is that correct, Mr. Halliday?
That's right.
And could you explain to us broadly what the information is that's contained within that, not looking at the detail, but the sort of thing that we were trying to convey when putting these things together?
Yeah, in April, if I recall, the Scottish Government published a paper about the handling of the pandemic under the theme of the 4 harms, which are here the COVID harm directly from COVID, harm because of the effect of COVID on the health service, on society, and on the economy. And what our role was as analysts in government was to bring the range of evidence together under each one of those harms. And what the picture shows here are some 5 key indicators for each of the harms, with a picture of the value of the indicator and how that's changed and how that compares to the status before the pandemic. And it's red, amber and green to mark, to highlight areas of potential concern.
So would it be fair to say in this 4 harm strategy that where a box was marked red, which would be the highest category, that would be an indicator of the fact that there was a particular strain in that area that was increasing that harm potentially?
It's an indicator of that, yeah.
Yes, and the colour coding is in order to try to catch the reader's eye and attract them to the things that are perhaps more stable and the things that are perhaps less stable based on the statistics.
Indeed so. And later on in the report, as then a lot of the detail that goes behind these headline numbers.
And as you say, they're split into 4 harms. One of the questions I wondered if you might help us with, Mr. Heald, was obviously the 4 harms are, as we've heard already, the first relates to the direct threat to health from COVID, the second, broader health harms, the third, society, and the fourth, economic. Which of the harms would data be fed into this machine which would emanate from PHS?
Yep. So looking at that report, data from harm 1, so COVID direct health, there are a number of indicators there that would have come from Public Health Scotland, and broader health harm 2 would be the other area where data from Public Health Scotland would have fed in.
Because those are the 2 health-related harms. And who fixed what the indicators were in each box?
So this was a decision of the analytical and also sort of the leads within Scottish Government on each harm. So my team would work with the Chief Medical Officer on harms 1 and harm 2. On harm 3, the Chief Social Policy Advisor would take the decisions on which indicators are, and on harm 4, on the economy, it's the Chief Economist at Scottish Government.
So they would fix what the indicators were they wanted information about, and it would be provided. It may emanate from PHS or some other source. Were you involved in the actual fixing of the indicators to any extent?
So I would just clarify that what would happen is a discussion between the analysts and those people that I've mentioned, because not necessarily the data might not necessarily be available for the exact concept that they'd be looking for. And I guess the role of my team was to collate this information. So the information would be put together by different statistical and analytical teams from around Scottish Government or from other places, and we've mentioned Public Health Scotland, National Records of Scotland as well. And it would be up to my team to commission updates from the various statisticians and to put it together and put it into the format that we can see presented here.
And what was done to try to make the information, not just contained on this page, but throughout this quite lengthy document, which you say was produced regularly, to try to make the information digestible and comprehensible to those who would need to take decisions on the basis of it?
Yeah, well, I guess that what we have is a group of quite senior analytical staff with significant experience of doing exactly as you've described, presenting complex information, multifactorial information in ways that can be digested by politicians and by senior officials. And so the people putting this together are well trained in exactly that task.
Is there a risk by using, for example, a single page like this and by using the colour coding that someone might, looking at this, simply look at which area is more or less red, think that's the thing we need to deal with now and not interrogate the detail?
I think that would be up to them, but as we've used similar kind of presentations when we're looking at overall performance of government in the past. So I think it's something that ministers and other senior officials are relatively used to the risks that you presented there. And
did you, from your perspective, get feedback from ministers or senior officials about the comprehensibility of this obviously very significant and broad database?
We certainly got questions about some of the detail.
Yes, but as far as the overall system of presentation was concerned in these quite lengthy documents with this key indicator element to it, was that something that they fed back saying, yes, they had a good handle on it, or was that something that they struggled with?
I certainly can't recall any feedback about them struggling with the presentation of the information. It was more that we would get questions that looked very much like they had understood and were reflecting upon and asking for further detail on some of the evidence that's provided.
And This may, I have to be clear, be indicative of the timing of this, but we're not going to go through every page of the document. But having done that myself, I wondered whether it might be fair to say that the majority of the document contains information, much of which I suspect may have emanated from PHS, about what's described as the first harm, tracking the ebb and flow of the pandemic. Is that correct?
I suppose we wanted to make sure that it wasn't a document that was focused just on the first harm, that it was reflected indicators across all four. What was unique about the first harm was the data was updated for at least a couple of the indicators on a daily basis. So it was much more frequent, and it changed much more frequently than in terms of what the numbers were actually saying than some of the other harms. So it was unique in that respect.
And as far as, there is, I should say, some information about the economic side, which is contained later. Was it difficult to try to either find data or find data that would assist, in particular with harms 2 and 3, which might be slightly more difficult to encapsulate in a format such as this?
I think that it actually was, I thought it would be more difficult than it actually turned out, in that some of the data available for the economy was actually available on a fortnightly basis, where previously it had been available on a less frequent basis.
Because one might say, for example, in harm 3, there's information about vulnerable children attending school, people describing themselves as lonely, people who trust the Scottish Government to work in Scotland's best interests, applications to the Scottish Welfare Fund, and the total coronavirus interventions by Police Scotland. One might say that there are a very large number of categories that aren't taken into account, which would fall into the area of societal harm.
That's absolutely right. Some of the, as you'll have read later on in the document, go into that, but we had to take a judgment on what information to present to make it digestible.
Thank you. And perhaps I might ask you, probably my final question, Mr. Heald, just in relation to harm 2, where PHS had a significant input. If we could just have a look at that. Again, there are a number of criteria that are there relating to hospitalisations and, in particular, cancer. Yep. There are, I think, a number, one might quite reasonably say there are a number of non-COVID related harms that aren't reflected there. Were similar issues experienced as Mr. Halliday's described in that regard?
Yeah, I mean, I think, again, as Mr. Halliday said, a judgment call about what's available. And I guess this is a snapshot of this report at a particular point in time. So, again, I'm unfamiliar with whether indicators changed throughout the course of the pandemic. I think the other thing I would say is, while this is a document that was shared within government, Public Health Scotland did still continue to publish data on a whole range of health and care statistics that we had in place prior to the pandemic that continued beyond that. So other data about other areas of health was still available throughout the pandemic.
So, for example, mental health, obviously, as we know and we've heard, was a very significant non-COVID related harm. It doesn't feature there, but are you suggesting that that would be something that PHS would have been compiling throughout the pandemic?
We still published statistics on mental health throughout the pandemic, yes.
Thank you very much indeed. If that's a convenient moment, Lydia.
It is certainly. I shall return at 13:42. Thank you.
Thank you very much.